Welcome to Baby Then What, the podcast you didn't know you needed for the real, unfiltered side of motherhood.
I'm Amanda.
And I'm Jessie, and we're just two moms of two in the thick of it.
We're sharing the real and unhinged side of motherhood no one else talks about.
If you've ever said, I had a baby, now what? You're in the right place.
By the way, you're doing amazing, even if no one said it today.
Welcome back to the Baby Then What podcast. We have a really fun episode today because this is a decision many people have to make, whether you go with an OB or a midwife. And a lot of when we started going, when we became pregnant, we didn't know which one to choose. We didn't even know there was an option, to be honest. I didn't even know what
I obviously heard of midwife in like movies. I always relate to that, but never really heard about it. And so I was like, no, you're going to an OB and that's what you're doing.
Yeah, exactly. So we didn't even know there was an option.
And pause that even, your GP is the one sending you to the OB.
Yes.
They refer straight to the OB because they're also a doctor.
Right.
So just like side note on heart.
So this episode is all about a perspective that we wish we had when we were pregnant for the first time, and even second, to be honest.
Yes.
And we're going to share with you some of the things that we learned and some of the questions that we think you should be asking the different doctors that you are going to meet or midwives or whatever, so that you can get the information that you need to make the decision that makes the most sense for you.
I agree. And one size does not fit all.
No, and you can pick a different person for a different pregnancy.
And you might need an OB for one, and you might totally be fine for a midwife and vice versa.
Right. So let's get into it. Oh, before we get started, just don't forget that we have all of our most recent episodes live on Spotify, Apple.
Subscribe so you don't miss an episode. A lot of our recent ones are amazing. Like all our episodes are amazing. That's my plugin.
But I can never say YouTube other than the way our logo.
YouTube. But let's jump into it. I'm really excited because I honestly, if you guys have been following us from the beginning, Jessie did use a midwife, and we will get into that. But I did not know anyone who ever used the midwife until you came along, Holly came along. So it is the first decision every pregnant person faces, and nobody explains it properly.
No, nobody even lets you know that there's options. Now, maybe in your specific city they do, but I would say for 98% of people that I spoke to, it was not something that was presented to us. And no, I think now having been on this side of it, it's a very big and personal decision.
I agree.
Who you choose to deliver your baby with, because especially if it's your first time, the information that you're getting before the date of delivery is so critical too. Like, I got no information from my OB. I had to hire a doula versus had I got a midwife. Anyway, we'll get into
all of it, but we want to say that you're going to hear from two people who've been through it in both an OB and midwife, and you are also going to hear it from Jessie, who has done both with both of her kids, which is also a very interesting take because you have done it both, and I always ask you at the end, and I'll ask you at the end which one you pick.
I know.
Again, so we will let her. So stay tuned till the end of the episode because Jessie will tell you which one she would pick.
Okay, good.
Okay, yeah. So
what's the difference?
The biggest difference in 2020, let's say we'll start it from when we had our kids. So 2020, we started going to 2021, is you going in thinking that the OB that you are seeing is the OB that you will see every visit and the OB that will deliver your baby. That was false news.
Keep in mind, this is in Canada.
Yes.
It's possible that in the States, you could deliver
your OB
the whole time, your OB specifically, but I don't know if that's consistent across all hospitals.
No, here it's not. Here you get an OB assigned to you through your GP. That's usually how it works. Sometimes you're lucky, sometimes you're not, and sometimes at least you are able to switch, which was a good bonus. But you have to understand and expect that OB will not be delivering you if they are not on call.
Yeah.
And every time you go for a visit, they might not be there. There'll be an OB doctor to see you,
right,
but it may not be the one that you start off.
Right.
So that's the first biggest one with OB.
You also have to consider that when you're getting an OB, you're also it's more you're getting a hospital. Like you are getting referred to a hospital, and then once you get referred to the hospital, you get assigned an OB. That's how it works in Canada. In the state, I think you can, again, you have to pick a hospital.
Yes.
And then a doctor at a hospital where you could potentially get matched ongoing. But I would say, like, in general, when you're looking at picking a hospital, you should be researching the hospital a lot.
Yeah.
Because there's hospitals with higher C-section rates, there's hospitals with higher medical intervention rates.
Yes.
Like, these are important things to consider when you're picking that.
100%.
The OB fits under that bucket.
So it's also, and at these hospitals, as I said, this is not going to be just your OB, it's a group practice. So you are getting more than one, technically.
Yeah.
Like you will see more than one. You could get different opinions, which I did think that was cool too. Like I've spoken to a couple OBs.
I didn't have that at all.
So this pregnancy, I've spoken to like 4 OBs. I brought in
Interesting.
like different tips and tricks from like different OBs in the same practice. So as much as you're like, you just want one the whole time, you got tidbits from different ones.
Right.
Your appointments are for sure shorter. You were at a hospital. There is millions of fucking women there. It's a fucking factory. And definitely at a hospital, if you are choosing the OB route, there's definitely more medical intervention going in. And a lot of the time with these hospitals, they're teaching hospitals. So you are also have a lot of students. I had that experience yesterday. I didn't for the first time.
When I was giving birth at the hospital, they were like, I think a class of like 5 people walked in and everyone was just right
So
up there.
well, the hospital that we were at it's a teaching hospital.
Yeah.
So
Most are.
I didn't know that though. I didn't know that till
You can always say you're not.
You can say
comfortable.
no, but how do you not? I feel guilty. I felt guilt. Like yesterday, I had an ultrasound. I was like, I've had so many. I've had a high risk pregnancy. Like I'm done. Like I was so ready to get the fuck out of there. And this poor girl's looking at me, being like, "Can I just take a couple pictures?"
No.
Because she's learning, and I'll be
Right.
say no. Be like, she's gonna be the next one for like my daughter, and I just say
Yeah.
no. She could fuck up her picture.
Yeah, exactly.
So those are a couple snippets from that, but
a midwife, we'll get into more of the details in a second, but basically a midwife is qualified to deliver babies. I believe they go through some version of medical school, but they're not qualified to do other things. They definitely are not qualified to do a C-section, whereas an OB is.
yes,
So, like, for an example, a midwife, in the way it used to work, or in smaller towns, that the midwife would be like delivering all the easy pregnancies, and OBs would be reserved for complicated ones that needed anesthetics, C-section, high risk, breech, all that jazz. So midwives are able to deliver
a low risk.
normal, low risk pregnancies, and it's a much different philosophy there. So a lot less intervention is offered. You can do it. You can always ask for something.
100%.
But it's not pushed as much. The appointments are a lot longer. You actually are seen at your appointment time. So if you have a 9:30 appointment,
They were seen at that time.
yes, you're not versus at an OB office. I don't know if you had that.
I've been there for an hour, and I've been there for 4.5 hours.
Yeah,
for the same
never know. They're also easily contactable. Like I found with the OB, you have to like go through the receptionist. Like rarely do they give you their phone number or email, versus with the midwife, it's like it's just a regular office.
Yes, you need something, you're getting it in that basically in the next 5 minutes.
And then the difference with the midwife and the OB, the most drastic one in Canada, is that midwives work in team of 2. So you meet both midwives. One of those 2 will deliver your baby. So you often will see the same one over and over. I guess for me, it was the same one, and then the other one delivered.
Yes.
But I had met both. They had similar philosophy.
Yes.
They worked the same. They were a team. So
Getting the
vibe, it's just a different person. But you know it's going to be the
One or
version
the
of
other.
this person. And if you don't like those people,
You can switch it
you
earlier on.
exactly.
And I think one big one is aftercare.
Thank you. That is the biggest one, to be honest, actually.
So I have an amazing OB right now, and I'm dealing with high blood pressure, and she's like, I want to see you. I never had a doctor. I want to see you at the 6th week, because you know what happens at a doctor's office at a 6-week checkup. Right now, actually, the guy checking me out, there's like a guy who checks me out. He is amazing if you're watching, but he was like, let me know if you want to come in. If not, it's just a phone call. Like that is like, they're like, let me know. If not, have a good life, basically. That was like the checkout guy. So I'm basically at the end. Whereas I'm high risk, with all my pregnancies, but this one, like my blood pressure is really high, where she goes, I want to see what your 6 week, I'm on blood pressure medication right now. So she goes, I want to see where you're at then. But basically once that 6 week mark hits, that is it. And that is not every doctor. So if I didn't have high blood pressure where I'm on medication,
Yeah, like I was normal. I got
you
nothing.
basically you deliver the baby, they did their job, you're done. They don't give a fuck in the nicest way possible.
No.
OBs are there for baby and you until you deliver, and then they know nothing about the baby. Truly, they're more on like the pregnant side, not the physical baby coming out, whereas a midwife is you and the baby.
Yes.
That's the biggest take from what you taught me also.
I agree. So the biggest difference is the continuity of care. So you see both a midwife and an OB will want to see you starting at around 12 weeks. So like your first trimester. Before that, you go to like a family doctor or whatever. Yes. So the starting point is 12 weeks. But to your point, the midwife will see you until your baby is 2 months old.
Yes.
The same midwife will see you. Now,
For you and your baby.
exactly. The frequency of the appointments leading up to delivery is about the same. I would just say the appointments are better on the midwife side because it's at a smaller office. You're not at a hospital. It's nicer. It's easier. You don't have to go. You can't do blood work there. Like you have to go separate, but whatever. And they do like the ultrasound. They can do it there.
Right.
So it's mostly consistent and the level of care you get. But the game changer, the true game changer between a midwife and an OB is the during and after care.
Yes.
Right after.
That is the biggest
That is the
difference.
game changer. So for example, if you have an OB, you deliver in a hospital, they will need to keep you in that hospital because you don't have a doctor monitoring you. So they have to monitor you. They have to monitor baby. So you have to stay at the hospital until you pass all those tests.
Once you pass her.
They send a lactation consultant, maybe, kind of helpful, not really. Once it's done, you don't have a point of contact.
That's it.
You're done.
Unless you are doing a 6 week follow-up. That's a long time.
And to your point, it's not related to the baby. It's just related to your vagina. That's it.
Are you bleeding? If you're bleeding, you might have a follow-up.
Do you feel bad? Yes, no.
Are you postpartum depression? And now we're going to send you a pamphlet and go deal with that.
6 weeks. So usually some people have the postpartum and
Way
done
before
by then.
6 weeks though.
A midwife, so here's this. The midwife is a doctor, I guess, because once you deliver your baby, and we'll get to location in a second, it doesn't matter where. Once you deliver that baby, you are going home. Unless you had some crazy complication where you need to be admitted, regardless of where you deliver the baby,
You're going home.
you go home within a few hours.
We met Benny 5 hours after he was born.
Yeah. So the midwife will do all the tests on you like a doctor would, make sure you and the baby. They have 2 midwives at every birth because they consider you and the baby different patients.
Yes.
Once that baby is born, you each meet a doctor. That is not
No,
mentality they use with the OB. Like,
They have nurses.
but they treat you and the baby as separate.
They don't the OBs don't ask about the baby.
You know, here.
After.
Yeah,
They're all concerned about the baby and you during. After, they don't ask about the baby at your 6 week. It's just you.
No, they care about you and did you heal and all
Yes.
that stuff. But then so the midwife will send you home the day you give birth within a few hours.
Yes.
And then they will come to your house the next day to check on you. All the tests that they do at you in the hospital, the midwife will do with you at your house.
Yes.
They bring their special thing with the pricks and all that jazz. So you don't have to do any of that. And you get to go home and be in your bed and shower in your own house. All this you don't pack a hospital bag.
There is no
It's
hospital.
the craziest thing. There is no hospital bag.
No.
Like,
No.
it was a very crazy experience to like birth the baby and then leave home.
I know.
So and then the midwife will come to you at 3 days. So she comes to you the day after, 3 days after, and then you go to them like a week after, 2 weeks after, 4 weeks after, 6 weeks after. And at each of these appointments, you are explaining all your issues. So not just your vagina issues, you have your breastfeeding issues, you have your hormone issues, you have your postpartum, as they have their network of people that are going to help you deal with that. And they have their network of people that could either meet you at clinic or come to your house or what. Like, you have so many more resources available to you. Like, had I been a first-time mom going through that, I would have felt so supported.
100%.
I would have been like the happiest person.
100%.
Obviously, second time around, still great. But I felt a little less like,
Right.
I didn't need it as much, so
Right.
to speak. But I think you always need lactation.
I think you always need lactation. I think especially as a first time mom, I think you always need support. I think second and third time mom, you need support. And it's like a I think it should be like together. Yeah. Like, well, for example, Jessie was lucky enough she had a low risk pregnancy. I would never be able to use midwife. I
agree, it was not an option.
It was never an option. First kid, it was never an option. Second kid, I've been on like drugs for all the
But I would say in your scenario, which is what I did the first time, I added a doula. Yes. So if you're going the OB route and you are high risk and you don't feel comfortable with a midwife because that's just not your jam,
right.
I would recommend, if it's your first baby, to do an OB and add the doula gave me all the information I wanted. Everything that I didn't understand about birth. Like, you could do birthing classes for sure.
Right.
This will give you all the information. But a doula came to my house. She brought her pamphlets, which, by the way, scared the fucking shit out of
There's also pros and cons to that too.
But she was my point of contact.
Yes.
And she only comes like in the last month.
Right.
She's like your labor and delivery person.
Right.
She came to the delivery. She's supposed to be, or he or whoever is supposed to be advocating for you with the OB.
Right.
Listening, doing all the things. So,
and helping you if you are laboring at home is not knowing what to do.
yeah.
Calling you.
She was like, go to the hospital now.
She told you when to go.
Yeah. So she would, so they're that one level added. They're just expensive. Like, I think it was like a couple thousand, maybe it's $1,500.
Wow.
I don't know. So, like, I mean, it's for time.
100%.
I get it. But
It gave you a little bit more like I went in blindly.
yeah.
Totally. Most of us go in completely blindly without knowing anything.
But if you're like hyper anxious and like want the care of a midwife, but no was giving up,
then that's a good
or like think that you just don't want to let go of the OB hospital thing, which I totally respect and get.
You get a bit of it with the doula.
You get a bit of it with it.
There you
So
go.
it's kind of like the best of both.
There you go.
So let's talk about where you deliver. What are the options?
So we have the hospital, obviously. You have the birthing center, which is where Jessie did it. And then the midwives also, you can do a home birth. We have not done home births, so we can't really speak. So that,
No friends that have had to.
but not on purpose.
Yeah.
Not on purpose. But so let's start with the, so you are allowed to get an epidural because you are there and they have anesthesiologists to deal with that. You have full medical support from top to bottom. So God forbid there is an emergency C-section. God forbid the baby's not coming out and you need a vacuum and everything else. I don't have to go into it. You have every single thing and doctor on call. There's also more than one doctor there.
Yes.
And a lot of fucking nurses. So you are not in one size fits all like category where there's, as Jessie's saying, two people kind of there.
Yeah.
You also are delivering with every time guaranteed 2 doctors and 2 nurses in the room with you, if not more. And God forbid something happens and they think something's wrong with your baby,
Right away.
you have a NICU team ready to go. Like, I remember when I even delivered Ace the second time, because he was 37 weeks, there was a NICU team ready to go because you have no idea what's going to happen.
Yeah.
But also, yeah, it definitely feels clinical. Like, you are going in, like, the room is pretty clinical. That's why we did a whole hospital bag thing. I'm bringing like a pink pillowcase in this just to make it a little bit more homey, whereas Jessie will fully talk about the other side where like she was in a fucking big bed, her and her husband were laying down together. Like, the bath, the shower,
different.
it's more homey, obviously, but that is basically the biggest difference with the actual location of the birthing center. It's a medical building. You're in a hospital.
It's a medical building, and I think you have like a lot of first-time moms would want to pick a hospital. Like, I know I did because, well, at the time I didn't think I had an option, but it just, you feel more safe because you know there's like full medical support. Also, if you feel like, I mean, you're not going to know what a contraction feels like the first time around.
No.
But if you want a contraction, you got to get an epidural at a hospital. No one's offering you epidurals anywhere else.
Not at home, not at a midwife. Those are all doctors.
So then let's talk about a birth center / home birth. So this is where I don't know what it's like in every city, but here in Toronto, they have a home birth center. They only have a few rooms, so you have to know a midwife is the only one that can check you in. And you basically get to use the room for the duration of your birth, and then they literally kick you out. Like, once you've given birth and past the like 1 to 2 hour
Mark
period and past all your things, you're out of there and you're at home.
Yeah.
So it's like you're in and out. But once you're birthing, obviously you're staying
100%.
But as you said, it's like a big double bed. There's a bath, there's a shower. It's just you guys. They
If
have
you're in a 1-bedroom suite.
but it's clinical. Like they have all of the schmetta, the towels and the this. Like at first I wanted to do a home birth, and then she sent me the list of things that I needed. I
We
was
have a
like,
million things.
no chance I'm having 950 towels. I have to clean up. No, thank you. So I got the benefit of the home birth without the cleaning, and and then you have the 2 midwives there. It's kind of cool. There's the main midwife watching you, and the other midwife was out like napping on the thing because it was the middle of the night. And if I put a show on,
She came in.
they both were there.
Right.
But once you're pushing, they're like on
They
it.
need
But
help. One is
so-
enough.
the midwife is very talented. I will say, obviously, OBs deliver lots of babies. Midwives deliver tons of babies. That's like the girl had delivered 500 babies.
Right.
Like she knows what she's fucking doing.
For sure.
But so people that were concerned, like Josh was petrified. They're shitting
Never.
his pants the whole time. But she's really on it. Like she was like, would have made the call. Like if the baby's heart rate was like she was following me around with the stupid fucking thing. And I was like, go away. I'm dying here.
Right. Can you just like give me a second?
Give me the space. But so I felt very taken care of. It was also my second. So I felt more confident that I had a normal first.
That's a big thing also. Like you went in being like, you technically had a low risk pregnancy with Ziggy.
Yeah.
You delivered him properly.
Nothing
There were no complications. It's a big thing.
Yeah. So then a couple factors you have to consider. There's no epidural. So
Even if you're fucking like you're shaking, they don't give a fuck.
it's not, there is no,
Well, they can't do it.
There's
How
no,
you need an anesthesiologist.
you
can't
had
do it.
gas, which did nothing.
No.
So about the middle of the birth, I was like, we need to go to the hospital now. I was thinking, call 911, get the ambulance, rush me over.
What do they do? They can't give me an epidural either.
No, but she was like, no, you have to go downstairs, get in your car, drive to the hospital. So it does take a lot of willpower, and it was kind of really tough. And but there was also a point where you're just like very animalistic and feral, and you're just like, I'm gonna fucking do this.
Well, you're like, oh, you don't have a choice. It's loud. I'm like, no, I have a choice. Once you're in it, like, it has to come out. Like, what do you, like,
You don't have a choice. So here's my strong recommendation if you have this option available to you. And I only learned this after
100%.
midwives can deliver at a hospital.
Yes.
So what I would do if I were you, and if you're a first-time mom, I would pick the hospital that you feel comfortable delivering at, something that, you've heard good things, people have had good experiences, facilities are nice, they have a low intervention rate in general, right? And hire a midwife that works at that hospital, because midwives have privileges at hospitals.
Yes.
Did not know that. So you can have the best of both worlds. You can deliver at a hospital, but with a midwife.
Did not know
You
that.
can have all of the benefits of the hospital. So in the event
There's an emergency.
you have OBs, in the event you have a not complicated pregnancy and birth,
There will be
delivery
come into the river.
right? He doesn't come. You deliver with your midwife, and you get the fuck out of there, right? You don't have to sleep at a big goddamn hospital
Because the midwife is in charge.
your
of you.
doctor. So the midwife basically the midwife follows you around. So you go to the birth center, they follow you. You go to the hospital, they follow you. They're your person. So if you want that, and in Ontario at least, the midwife is free. So the OB plus the doula, you have to pay.
Right.
The midwife is just free included. So you get the perks.
People don't know that.
I didn't know that.
And I know you did it.
So that would be my strong recommendation. Obviously, every city is different, but if you can pick a more, I think, holistic type doctor, because you can still get the epidural with the midwife at the hospital. So even if you want to try, the midwife can push you and coach you to not try the epidural, just like judge. No, mine was like, just so you know, you just have to get in the car and go. But if I was there, I think I would have got the epidural in the end. It was brutal. But I think, that's my best recommendation. Is there do the midwife thing.
Okay, so let's go through a little bit of a checklist.
Yes. I want to hear that.
To what you at home, not at home, well, you listening at home right now, what questions you can ask an OB, and then Jessie will go through midwife, and maybe that's going to help you. So to an OB, will I meet all providers before delivery? So Basically, when they say that, it's like your anesthesiologist, your doctor, and your nurses. And I'll give you the answer most of the time is no. You're
In Canada.
in Canada, you are not
is
meeting
different.
your anesthesiologist till they call for an epidural. And you better fucking pray that you get it, because a lot of women waited in waiting rooms. So my biggest tip with that actually is, if you feel any sort of cramp and you like, don't be a fucking hero, as my husband told me with my birth, get the fucking epidural, because you can say I want the epidural and you might not be getting it for a good 45 minutes to an hour, because there's not that many anesthesiologists in the birthday.
If you miss your turn, you're done.
But you miss your turn and you pass the phase of no epidural, you are not getting it. They don't care how much pain you're in.
No.
Who will actually be at my birth? That's a good question that they'll answer for sure for you. So they'll tell you it'll be 2 doctors, 2 nurses, and probably a NICU team on call, like there. And what's your approach to induction? Every OB has a different approach to induction. And I know that because I've had 2 different types of inductions. And I actually just spoke to my cousin in California, where her OB did not believe in the balloon. And she actually had a C-section. He preferred a C-section over the Foley balloon.
Whoa, these are good questions. What's your approach to induction?
Yes.
What's your induction day limit? Because that changes by hospital. Yes. So some hospitals will let you, yes. This is another thing with the OB and midwife. Yes. Some hospitals and OBs will let you start delivering as early as 37, 38.
Yeah.
Midwives push you to like 41 fucking weeks.
Yeah.
Just like,
And OBs do not like that, because they think that medically it could go too far. Things can happen with the baby, could be too big. So
what is your approach to induction is a good question, whoever your provider is.
I agree. So for example, I even asked that because like right now, I'm like, take the baby out.
Right.
Take the baby out. I have high blood pressure. Take the baby out. She's like, you had a baby at 35 weeks. You had one at 37 weeks. She goes, I want to keep this baby in till 37 weeks if possible. But if your blood pressure in the next 4 days skyrockets, you're taking the baby out.
Yeah.
So they believe that if it's medically really necessary, they are taking the baby out, because they are looking at both of you in that sense.
Yes. So, and linked to this then is, what are my pain management options? So this is applicable to both where you deliver, and who is delivering you. So, and what their approach is to pain management, right? Like a midwife will tell you what your options are at your different delivering outpatients. OB is going to just tell you what the options are at the hospital.
Yes.
But similar to the induction approach, what is their pain management approach? How are they going to make that decision with you? Are they going to make the decision
For you.
Like, you need to understand and gauge their ability to work with you.
Right.
And like also what they've done previously. Like, this is where I say go to the hospital stats or something. Like, how high is their C-section rate?
There's some doctors that push C-section.
Yeah.
I've heard it.
Yeah.
I've had friends where, from my real, and obviously, like, if there's an emergency C-section, take the fucking baby out.
Yeah.
All for emergency is an emergency.
Yeah.
But there are some doctors that push it when maybe the mom could have handled it a little bit longer.
Yeah. And same with the pain management, right? Like, are they just jumping to intervention, or are they trying other things for you?
100%.
One thing I forgot to mention with the midwife and the OB is that depending on where you're delivering, you will have to labor in triage or at your house. So here's the example. Yes, when you're with an OB, you can labor at home. Eventually, you will have to go to triage. Eventually, you will have to wait in triage for your room. Yes, you might not get a room right away because there's other people delivering. So you might be laboring the most intense part of your labor in a fucking triage bed.
Yes.
Which is literally versus a midwife bypasses triage. You don't go to triage.
No.
She's with you at your house.
If she believes you're ready to go, we're going to
She goes to the front of the line, says, my patient's ready to deliver. Go into the room. And same with the birth center. There is no triage. But if, to me, I was like, this is VIP. Like, I wish.
100%.
It would have been terrible.
100%.
It was terrible. There was not that much space in triage. No. It's been there 3 times in the last week. Anyway, that's just another pro.
Been there 3 times in the last week. You don't want to deliver. And my husband got scared. I didn't tell you. I'll give you a funny story. When we were there, they start yelling, crowning. I was like, what the fuck's going on? I was like, she's having a baby in triage right now. Yeah, she make it. Crowning with the baby's coming out. I was like, what is she yelling? It was like, The baby's coming right now, 2 doors down from you. Just want to go watch. I'm dead. Yeah. So you might not make it.
No. Okay. Wow.
Sorry, I forgot the help.
Okay, here's a couple other questions, and then
This is a good one.
yeah. Who covers you if you're not there? Like I said, the midwives have their team. The OBs will tell you. My OB's shift finished at 5,
Right.
and I delivered at 5:45, and she bails. Like,
See, so that's the same with the doctors. So that's the exact same.
yeah.
They're going.
And these are a couple of things you can ask yourself. Do I feel heard at my appointments? Do I want to know my provider personally and what makes me feel safest? I think it's just gauging, is this the right fit for you? Sometimes you don't have a choice.
Yeah.
But you still advocate for yourself as much and as possible.
I agree.
Yeah, there's no right answers. We are just giving you a variety of opinions. I obviously told you what I think, but again, just my opinion,
Yes.
as of my experience. Other people have probably felt different ways.
Do your research. If you are high risk, you can't do a midwife. I don't know how to say that in the nicest way possible. It's physically impossible. High risk, they're based up for sure, if your partner allows it.
What?
I don't know. I was like, there's no one else coming to the room.
We got like great video content.
By the way, I was watching some of the videos yesterday. You were literally dying in one video, like diaper out. And Josh was literally taking selfies. But I don't know why I was looking at it yesterday. I think I'm like preparing myself again. I'm like, Josh, like the photos he took of you.
Ironic.
Wait, with Ziggy, not Betty.
Yeah.
Were absurd.
Well, because
You're literally suffering. He's like, yeah.
I gotta make some content.
We all talk about that, by the way. One of Adam's friends, I was on the phone with him. He was like, remember when Josh went live? Would Adam ever go
I
live?
wish we could see it.
It has to be somewhere. If we can post it, I would do anything to post that. But if this helped you, which I'm sure it did because it has helped me even listening to it again, and Jessie telling her stories all the time always helps me.
Yeah. Hearing him, your friends.
Send it to a pregnant friend if they just found out they're pregnant and they're about to make this decision. This is a great episode for them.
And we want to know what you guys have picked. Comment OB or midwife.
Said why. And why. So we can let all
Like, it's a
know.
conversation going because not enough people know, and
People don't know. You're right. People don't know that there's options. So let's start it. I agree.
Okay, well, thanks, guys. We'll see you next time.
Next week.